The NAADAC Code of Ethics is essential for guiding addiction professionals in ethical decision-making and practice. This episode complements the NAADAC Code of Ethics course by Therapy Trainings, offering insights into the ethical standards that govern conduct in addiction treatment. We will discuss core principles such as non-discrimination, client welfare, and confidentiality, along with common ethical dilemmas faced in the field. This discussion aims to clarify how these guidelines can enhance your practice as a counselor, therapist, or mental health provider. As we navigate through this episode, we will highlight the key principles of the NAADAC Code of Ethics, explore decision-making models for ethical dilemmas, and discuss the importance of cultural competence. We'll also touch on confidentiality, informed consent, boundary management, and the responsible use of technology in our practice. By the end of our time together, you will have gained valuable insights that not only enhance your understanding of ethical standards, but also provide practical strategies for your day-to-day work with clients. Let's jump right in. One of the first things we consider when discussing the NAADAC Code of Ethics is its core principles and values. These principles are not just a set of rules to follow. They represent the foundation of our professional conduct. They include integrity, respect for the dignity of all individuals, and the commitment to promote the well-being of clients. Have you ever faced a situation where your personal values clashed with professional obligations? It's not uncommon. The NAADAC Code reminds us that while our values are important, our priority must always be the welfare of our clients. This is where ethical decision-making models come into play. Imagine you're working with a client who is struggling with substance use and begins to reveal troubling details about their home life. You might find yourself in a position where you need to decide whether to breach confidentiality to ensure their safety. This is where understanding various ethical decision-making models can help. One effective model that we discuss in the course is the four-component model by REST, which includes moral sensitivity, moral judgment, moral motivation, and moral character. By following this model, you can systematically approach ethical dilemmas. First, you need to recognize and identify the ethical issue at hand. This is moral sensitivity. Then, you assess the situation to determine what the right action would be, which is moral judgment. Next, you need to consider whether you have the motivation to act ethically. And finally, you demonstrate moral character by actually taking the steps necessary to resolve the issue. It's a structured approach, and it's incredibly useful in navigating the complex ethical landscape of addiction counseling. Now let's shift gears and talk about confidentiality and informed consent. These are two pivotal concepts in our field. Confidentiality is not just a best practice, it's a legal and ethical obligation. It fosters trust between you and your clients, allowing them to feel safe when sharing sensitive information. But here's a common misconception. Some professionals think that confidentiality is absolute. In reality, there are exceptions. For instance, if there's a risk of harm to the client or others, you may need to disclose certain information. It's crucial that you clearly communicate these limits to your clients during the informed consent process. Informed consent isn't just about getting a signature on a piece of paper. It's about ensuring that clients fully understand what they are agreeing to. This includes discussing the nature of the treatment, the potential risks and benefits, and any limitations concerning confidentiality. By engaging in open and honest dialogue, you empower clients and help them make informed decisions about their care. Another vital area we need to address is cultural competence. In our increasingly diverse society, it's essential that we provide ethical care that respects and acknowledges the unique backgrounds of each client. Cultural competence involves understanding and integrating the beliefs, values, and practices of various cultural groups into your treatment approach. For example, if you're working with a client from a culture that emphasizes family involvement in decision-making, it's important to consider how this might impact their treatment plan. By recognizing and valuing cultural differences, you not only enhance your effectiveness as a practitioner, but you also uphold ethical standards that promote respect and dignity for all clients. As we continue our exploration, let's talk about maintaining appropriate boundaries and managing dual relationships. This can be particularly challenging in addiction counseling, where clients may often see you as a crucial support system. Boundaries are essential to protect both you and your clients. Dual relationships can arise when personal and professional roles overlap, such as when you provide therapy to a friend or someone from your community. While these situations can be tempting, they often lead to ethical dilemmas that can compromise the therapeutic relationship. It's vital to be aware of these dynamics and establish clear boundaries from the outset. This brings us to an important point about the use of technology in our practice, especially in today's world where telehealth has become more prevalent. The responsible and ethical use of technology in addiction treatment is crucial. While teletherapy can increase access to care, it also raises unique ethical challenges, such as ensuring confidentiality in a digital environment. Always remember that your ethical obligations extend to the digital realm. This means using secure platforms for communication, ensuring that your clients understand the risks involved, and maintaining confidentiality just as you would in a face-to-face setting. Documentation and record-keeping are other critical components of ethical practice. Proper documentation not only protects you legally, but also enhances the quality of care you provide. It's essential to maintain clear, accurate, and timely records that comply with industry standards. This includes documenting informed consent, treatment plans, and any communications with clients. In addition to these practical considerations, let's touch on family and couples therapy within the context of addiction treatment. Ethical issues can become particularly complex when multiple individuals are involved. It's essential to clarify your role and the potential conflicts that may arise. For example, if you're working with a couple, it's important to discuss how you will handle confidentiality and informed consent for both parties. By setting clear expectations and boundaries, you can navigate these challenges more effectively and provide ethical care that addresses the needs of all individuals involved. Now, let's address some common misconceptions related to the NAADAC Code of Ethics. One misconception is that ethics are static and unchanging. In reality, ethical standards evolve over time as our understanding of issues like addiction and mental health deepens. It's crucial to stay informed about these changes and adapt your practice accordingly. Another misconception is that adhering to ethical standards is solely the responsibility of the individual practitioner. While you are certainly accountable for your actions, ethical practice is also a collective responsibility that involves your workplace, colleagues, and the broader professional community. Engaging in discussions about ethics with peers, seeking supervision when needed, and participating in ongoing education can help foster a culture of ethical practice. As we wrap up, let's take a moment to reflect on the importance of self-care and professional development in maintaining NAADAC ethical standards in addiction treatment. It's easy to get caught up in the demands of our work and neglect our own well-being. However, taking care of yourself is not just a personal responsibility. It's essential for the ethical care of your clients. Engaging in regular self-care practices, seeking support from colleagues, and committing to lifelong learning can help you stay grounded and effective in your role. Remember, your well-being directly impacts your ability to provide quality care to those you serve. In conclusion, the NAADAC Code of Ethics serves as a vital guide for mental health professionals navigating the complexities of addiction treatment. By understanding and applying these ethical principles, you not only enhance your practice, but also uphold the dignity and welfare of your clients. I encourage you to explore the course offered by Therapy Trainings for a more in-depth understanding of these concepts and to gain additional tools for ethical practice in your work. Visit therapytrainings.com to discover more courses that can enhance your knowledge and skills in this important area. Thank you for joining me today. Remember, ethical practice is not just a checkbox. It's a commitment to the people we serve. Let's continue to strive for excellence in our field. Until next time, take care and keep making a positive impact in the world of mental health.